Hello, this is Nursing School. My name is Patrick. This is first video in 5 video on the content of nursing process. Let's start together with the first step of assessment. Assessment. It is the first step of nursing process. Assessment refers to systematic and continuous collection, organization, validation, and documentation of data. During this step, nurse collect information to determine areas of abnormal function, risk factors that contribute to health problems, to identify the needs and health problems of patient. The focus is to identify the client's responses to health problem. Assessment is continuous process carried out during all phases of the nursing process. All phases of nursing process depend on the accurate and complete collection of data. The main goal is to establish a database. A nursing assessment include the client's perceived needs, health problems, related experience, health practices, values, and lifestyles. Database. All the information about the client. This include nursing health history, physical assessment, physician's history and physical examination, results of laboratory and diagnostic tests, material from other health personnel. Nursing involve critical thinking skills. To identify client's needs requires to think critically on what to assess. Activities in assessing phase include 1. To collect data, 2. To organize data, 3. To validate data, 4. Documentation of data. A data collection. Data means information. Data collection is the process of gathering information about a client's health status. To collect data clearly, both the client and nurse must actively participate. Data collection must be both systematic and continuous to prevent the omission of significant data and reflect a client's changing health status. The nurse must collect data that are descriptive, concise, and complete. Descriptive data is data originating in the client's perceptions of a symptom, the perceptions and observations, or reports from other members of healthcare team. Concise data is briefly describe the information obtained. Summarizing information in short format using correct medical terms. Complete data is obtain all information relevant to the actual or potential health problem. Types of data. The nurse collects 2 types of data: subjective data, objective data. Subjective data consist of information that only the client feels and can describe. They are also called symptoms or convert data. It includes the client's sensations, feelings, values, beliefs, attitudes, and perception of personal health status and life situation. Example: nausea, complaining pain, feeling nervous or worried. Objective data are observable and measurable facts. They are referred to as signs or overt data. They are detectable by an observer or can be measured or tested against an accepted standard. They are obtained by observation or physical examination. Example: temperature of 36.0 C, swelling, laboratory results. Source of data. Sources of data are primary or secondary. The primary source, client. Secondary source, include all sources other than the client are considered secondary sources. The client's family, reports, test results, information in current and past medical records, and discussions with other healthcare workers. Methods. Data collection include the following. 1. Observation is the conscious and deliberate use of the 5 senses to gather data: sighting, smelling, and hearing. 2. Interview is the planned communication during the assessment step of the nursing process to obtain and establish a successful working partnership with the patient, then to obtain the necessary patient data. Techniques of physical assessment. Physical assessment is the examination of the patient for objective data that may better define the patient's condition and help the nurse in planning care. Techniques of physical assessment include 1. Inspection, 2. Palpation, 3. Percussion, 4. Auscultation. Different approaches are used in physical examination or physical assessment. Head-to-toe approach begins the examination to the head, progresses to the neck, thorax, abdomen, and extremities, and end at toes. Body systems approach, review of systems. Nurse investigates each system individually. Problem-based, nurse focus on a specific problem area. Problems related to data collection are Inappropriate organization of the database. Omission of pertinent data. Inclusion of irrelevant or duplicate data. Misinterpreted data. Failure to establish rapport and partnership. Organization of data. Organization involves grouping related information. Interpreting data is easier if information is organized. Validating data. Validation involve action of double-checking, verifying data to confirm that it complete, factual, and accurate. Why to validate? Nursing diagnoses and interventions are based on the information collected during assessment phase, therefore data must complete, factual, and accurate. Tasks: ensure that assessment information is complete. Ensure that objective data and related subjective data agree. Obtain additional information that may have been overlooked. Differentiating cues and inferences. Avoid jumping to conclusions and focusing in the wrong direction to identify problems. A. Cues are subjective or objective data from the client that can be observed by the nurse. B. Inferences are the nurse's interpretation or conclusions made based on cues. Documentation of data. Last task in assessing phase to complete assessment phase. All clients' data must be recorded accurately. Data must be completed in factual manner, not interpreted by nurse. Thanks for following Nursing School. My name is Patrick. This is first in 5 video. Let meet together in next video. Please subscribe, like and share and leave with comment.